Tetralogy of Fallot. So what is this Tetralogy of Fallot? So Tetralogy of Fallot is cyanotic cardiac disorder, where this is congenital cardiac disorder which has 4 other congenital anomalies. So it is a combination of 4 heart defects that are overriding of Iota, ventricular septal defect, pulmonary stenosis and right ventricular hypertrophy. I repeat, overriding of Iota, ventricular septal defect, pulmonary stenosis and right ventricular hypertrophy. These are the 4 congenital defects which is associated with Tetralogy of Fallot. Fine. So mainly Tetralogy of Fallot is 4 congenital other cardiac defect. ഏറ്റവും important is these 2 things, that is overriding of Iota, that is always associated with ventricular septal defect, and pulmonary stenosis that always may lead into right ventricular hypertrophy. Okay, appo 4 congenital cardiac defect overriding of Iota, ventricular septal defect, pulmonary stenosis and right ventricular hypertrophy. So what are the causes? Basically, congenital cardiac disorders in causes and the basic cause for all of the disease is genetic. So it is something, a genetic transmission. So defective gene variations, transmissions, parents and the defective gene transfer a problem. Okay, so abnormal cardiogenesis or cardiac development during the fetal life. Okay, so genetic is the most thing, number 1 thing, and second is alcoholism and smoking, that is maternal history of alcoholism and smoking. That could also alters the developmental changes, or that alters the development during fetal development. The heart need to develop in a good manner, in a normal manner. But in case of alcoholism or in case of smoking, it alters the normal development of heart. Fine. Now, fetal heart in the development alter one reason is alcoholism, and there is another reason, that is smoking. Fine. Gestational diabetes. If mother has diabetes during the pregnancy, again that might cause. And elderly mother, that means if mother or female is getting pregnant after 35 of her age, മനസ്സിലായോ 35 വയസ്സ് കഴിഞ്ഞിട്ട്, that means elderly ആയിട്ട് pregnant ആവുന്ന അമ്മയുടെ കുഞ്ഞിന് normally ഇങ്ങനൊരു defect കാണാൻ chance ഉണ്ട്. And rubella infections. As we all know, rubella, it is like a fetotoxic virus, or it has a teratogenic effect. A maternal rubella infection may cause this problem. So, എന്തൊക്കെയാണ് causes നമ്മൾ പറഞ്ഞത്? Genetic, maternal exposure with the radiation, and maternal exposure or maternal habit of alcoholism and smoking, gestational diabetes, elderly mothers and maternal rubella infection. So these are the causes. Okay, so associated with all of these causes, normal fetal heart development alter during the pregnancy. Fetal heart normally develop development variations. Fine. Okay, so fetal heart develop the second video upload, so please watch. So next I will explain the signs and symptoms. Before explaining signs and symptoms, let me just say what is the pathophysiology. Okay, so look at this. This is a heart where Tetralogy of Fallot mark. Okay, so already Tetralogy of Fallot 4 conditions, 4 congenital defects already overriding of Iota, aorta, ventricular septal defect, pulmonary stenosis and right ventricular hypertrophy. So first we will look at what is overriding of aorta. Okay, overriding of aorta ennu parayunnathu aorta override ayi. Okay, so what is the normal position of aorta? Usually aorta which starts from left ventricle. Okay, as we all know, heart has 4 chambers: right atrium, left atrium, right ventricle, left ventricle. Upper 2 chambers, atrium, lower chambers, ventricle. Okay, and from right ventricle usually pulmonary artery originates and left ventricle aorta originates. Okay, appo heartinagathu രണ്ട് major vessel aanuള്ളത്, pulmonary artery aorta. Rendu arteries aanu. Okay, so major vessel inside the heart. There are 2 vessels. Okay, one is aorta and second is pulmonary artery. Whereas pulmonary artery which develops, okay, so it originates from right ventricle, and aorta which develops from left ventricle. Okay, so that is a normal position. Okay, appo left ventricle il ninnum aorta originate cheyyunnadinu pagaramayittu it slightly deviates, okay, and it originates from the ventricular septum. Okay, adu evidana originate cheyyunu ventricular septum. So this is aorta. Okay, aorta heart il ninnum puറത്തേക്ക് പോകുമ്പോൾ this is ascending aorta, arch of aorta, this is arch of aorta, and this is downward, adine descending aorta ennu പറയുന്നു. അപ്പോൾ ഈ aorta originate ചെയ്യുന്നത് usually ഇവിടെ നിന്നാണ് ഓപ്പൺ ചെയ്യുന്നത്, പക്ഷേ ഇത് it starts something here. Okay, അപ്പം ഇത് ഈ ഒരു പോർഷനിലേക്ക് വരുന്നു. Okay, so it starts from ventricular septum. Okay, so correct the ventricular septത്തിന്റെ junctionil നിന്ന് അത് originate ചെയ്യുന്നു. So there will be a ventricular septal defect. Okay, so aortയുടെ position change ആവുന്നു. Left ventricle നിന്നും originate ചെയ്യുന്ന aorta left ventricle നിന്നും തുടങ്ങുന്നതിന് പകരമായിട്ട് അത് right ventricular അല്ലെങ്കിൽ ventricular septത്തിൽ നിന്നും originate ചെയ്യുന്നു. അതാണ് overriding of aorta. Aorta override ആയി. Clear? So what happens as a result of this? Aorta usually left ventricle നിന്നാണ് originate ചെയ്യുന്നത്. As we all know, right side of the heart is having deoxygenated blood and left side of the heart is having oxygenated blood. ശരിയല്ലേ? Okay. So usually aorta receives oxygenated blood from left side of the body. But what happens in this situation? Aorta here it is originating from the ventricular septum. So what happens? It receives the blood from right ventricle, or as a result of ventricular septal defect. This is called as ventricular septal defect. Okay, as a result of ventricular septal defect, what happens? The blood which deviates or which shunts from right side to left side. Okay, and because of ventricular or through the ventricular septal defect, what happens? The right side നിന്നും blood left side ലേക്ക് shunting നടക്കും. മനസ്സിലായോ? Okay, left side of the blood is deoxygenated blood. Okay, deoxygenated blood right side of the heart ലേക്ക്, that means oxygenated blood ലേക്ക് mix ആവും. ഇപ്പോൾ ഇവിടെ നിങ്ങൾ ചിന്തിക്കുന്നുണ്ട് അതെന്തുകൊണ്ടാണ് റൈറ്റ് സൈഡിൽ നിന്നും ലെഫ്റ്റ് സൈഡിലേക്ക് പമ്പ് ചെയ്യുന്നത്? യൂഷ്വലി വെൻട്രിക്കുലർ സെപ്റ്റൽ ഡിഫക്റ്റിൽ തിരിച്ച് ലെഫ്റ്റിൽ നിന്നും റൈറ്റിലേക്ക് അല്ലേ വരേണ്ടത്? അങ്ങനെ ഒരു ഡൗട്ട് നിങ്ങൾക്ക് ഇപ്പോൾ ഉണ്ടാവുമായിരിക്കും. ഓക്കെ, so the basic reason for right to left shunt is because of right ventricular hypertrophy. Because of right ventricular hypertrophy, right ventricular pressure increases. Okay, but right ventricular hypertrophy കാരണം ഇവിടെ fully hypertrophied ആയിരിക്കുകയാണ്. Okay, so the right ventricular pressure increases. So this is hypertrophy. So as a result of this increased pressure, what happens? From right side usually the blood comes here, and from here the blood reaches here. So this is the shunting. Okay, so right to left shunting നടക്കുകയും iota receive ചെയ്യുന്ന blood deoxygenated blood ആവുകയും ചെയ്യും. മനസ്സിലായോ? So iota currently it is receiving deoxygenated blood. So what will happen? If iota receives deoxygenated blood, to our body only we receive deoxygenated blood. It always causes hypoxia or it causes hypoxic changes. മനസ്സിലായോ? അപ്പോൾ നമ്മുടെ ബോഡിയിൽ ഓക്സിജനേറ്റഡ് ബ്ലഡ് പ്രോപ്പർ ആയിട്ട് അല്ലെങ്കിൽ adequate oxygenated bloodന്റെ deficiency കാരണം each of our body tissues will undergo hypoxic changes and it could end up with a cyanosis. Okay, and next is pulmonary stenosis. What is this pulmonary stenosis? This is pulmonary artery which originates or which starts from the right ventricle. Okay, so right ventricular blood edana? Right ventricular blood is deoxygenated blood. Okay, so this is just starting from here. Fine. Okay, so each side of blood, what is this blood as? Deoxygenated blood. So pulmonary artery should receive blood from right ventricle and it should take this blood from here and it should give to the lungs. Okay, so pulmonary artery collect the blood from right ventricle and it should provide this blood to the lungs for purification. But because of pulmonary stenosis, what happens? The amount of blood which is collecting from right ventricle will be reduced. മനസ്സിലായോ? Pulmonary stenosis ന്റെ ഭാഗമായിട്ട് വളരെ കുറച്ച് ബ്ലഡ് മാത്രമാണ് റൈറ്റ് വെൻട്രിക്കിളിൽ നിന്നും പൾമണറി ആർട്ടറിക്ക് കളക്ട് ചെയ്യാനായിട്ട് സാധിക്കുന്നത്. Okay, pulmonary artery will only collect small amount of blood from right ventricle. Why? It's because of pulmonary stenosis. Okay, അപ്പോൾ വളരെ കുറച്ച് ബ്ലഡ് ലങ്സിൽ എത്തുന്നു. അതുകൊണ്ട് എന്ത് സംഭവിക്കും? ഗ്യാസ് എക്സ്ചേഞ്ചിന്റെ സ്പീഡ് കുറയും. Or the amount of blood which is circulating. Okay, so that will reduce. Gas exchange decrease down, ultimately that could end up with a hypoxia. Okay, so രണ്ട് main physiology നിങ്ങൾ ശ്രദ്ധിക്കേണ്ടത്. ഒന്ന്, overriding of aorta. Because of overriding of aorta and ventricular septal defect, the aorta receives deoxygenated blood and the systemic circulation impairs. Because of pulmonary artery stenosis, the blood which is received by the lung will also reduce and it causes hypoxia. Okay, so now basic physiology. So ultimately the total result of tetralogy of Fallot is hypoxia and cyanosis. Okay, so we will discuss the signs and symptoms. So what are the signs? One is cyanosis. As we said, this is a congenital disorder. So this particular patient will be kids, small child, newborns. Okay, so there will be cyanosis, and the cyanosis will be very commonly expected during activities. For example, while crying, while sucking, while doing any activities, cyanosis will be expected. Or you could see like acrocyanosis. What is acrocyanosis? Only the cyanosis will be expected in the extremities. Fine. That is called as TET spell. Tetrad spell or TET spell. Please remember this. Okay. And there will be breathing difficulty, dyspnea, decrease the saturation when you check. And there will be murmur. Usually in Tetralogy of Fallot, soft murmur is expected. Okay, soft murmur is expected. And if this murmur continues and if it is not like a soft murmur, you have to assess the client very frequently and it is indicating that extreme complication of pulmonary stenosis. So, thorough physical examination, periodical examination is necessary. And the patient will be always irritable or the child will be irritable and the baby will continuously cry. Why irritability? Because in case of hypoxia, the oxygenated blood supply towards the brain will also reduce, and it ultimately could end up with irritability. So the child will be irritable, and the child won't be properly sleeping, and the child won't be calm, and because of hypoxia always there will be chances to get a breathing difficulty, and while crying, while sucking, the baby will develop cyanosis. Okay, so the sucking will be very decreased sucking will be expected, or it could be like say that poor sucking. Okay, about poor sucking so as a result of poor sucking, nutrition will be deficit. The child will be irritable, and the child won't be like a calm. Okay, so everything will alters growth and development, and it could end up with a failure to thrive. And the basic sign is dead spell, breathing difficulty, and murmur. Apart from this, when you check blood, you will be able to see polycythemia. What is polycythemia? Increased number of RBC. Fine. And next we will discuss the diagnosis. How do we confirm the diagnosis? 2D echo, echocardiography, ECG, and X-ray. ECG, it is periodical assessment, is something important, and right ventricular hypertrophy always causes tall R wave and very deepest S wave. Okay, so you need to just identify that, and periodical assessment of ECG is important. And next is X-ray. Because of right ventricular hypertrophy, boot-shaped heart is expected. So again, please remember, boot-shaped heart is expected in Tetralogy of Fallot. Fine. Yes, how do you manage? So this is a cyanotic disorder. So since this is cyanotic disorder, you should not cause the baby, or you should not become a baby to be cyanotic. Okay, so the goal of the treatment is improve oxygenation. How do we improve oxygenation? Oxygen demand need to be reduced, and you can give oxygen. So always monitor saturation, and always maintain saturations within normal limit. And the second is decrease hypoxic episode. What is the situations where hypoxia is expected? ഏതൊക്കെ സിറ്റുവേഷനിലാണ് hypoxia expect ചെയ്യുന്നത്? Hypoxia is expected during crying, during feeding, during activities. Okay, so you need to reduce hypoxic episode by providing knee chest position. You can provide knee chest position or a squatting position. Okay, so see, always when you give knee chest position or squatting position, that will increase the vascular resistance, and that will reduce the shunting. Only here hypoxia or cyanosis will be expected as a result of shunting. So knee chest position will reduce shunting, and as a result of that, cyanosis can also be prevented or treated. Fine. So you can give morphine. See, why morphine? See, when you give morphine, it always calm the patient or calm the child, and as a result of that, oxygen requirement can be reduced. So what is the choice of medicine here? Morphine sulfate, or you can just sedate the baby during hypoxic episode. Fine. Yes. And the definitive management is surgical correction. See, surgical correction can be done almost after 6th month of the baby's age, 4 to 6 months. Okay, but if you are posting the client for a surgical correction, the hemodynamical vital signs or hemodynamical all parameter should be maintained within normal limit. PowerPoint prathegam sradhikkanam. And decrease cardiac workload and maintain nutrition. Why that is important? Why should we maintain nutrition? Because this is a growing age, and because of decreased oxygenation, it could cause infection, and it could cause failure to thrive, and growth and development will be delayed. So you have to improve growth and development, and for that nutrition need to be increased. and you have to take care this baby or take care this child because this child is considered as immunocompromised, so there will be chances to get infections very faster than other normal child. Okay, so since it has a surgical correction, you need to give information regarding pre-surgical interventions and post-surgical intervention. Even after discharge of the surgery, you have to take care of the baby and reduce cardiac workload, and always educate the patient's parents regarding the complication of surgery. This is all about Tetralogy of Fallot. I repeat, Tetralogy of Fallot is congenital cyanotic heart disorder with a combination of 4 other congenital cardiac defects such as overriding of aorta, ventricular septal defect, pulmonary stenosis and right ventricular hypertrophy. Okay, it causes cyanosis and it causes TET spell, hypoxia, murmur, and on X-ray, boot-shaped heart is visible and it can be corrected by giving oxygenation, but to reduce hypoxic episode and preparing the client for surgical correction. This is all about Tetralogy of Fallot. So please like the video, share the video and subscribe the channel. Thank you for watching. Bye.